Can you see my screen?
Yes.
Yes, please.
Okay. So we are going to review what we have done so far, so that for those who are joining for the first time today, they will get an understanding of what we are doing. We have looked at the training portal, and it's not part of the patient management and reporting system. Under the patient management and reporting system, we have looked at general population screenings, and we are looking at the pregnancy registrations and screenings and PMTCT. When you log in to your account and you are a VCT provider or you work in a lab, you most likely will have the general population counseling and testing permission granted. And so on the left side of your page, when you expand the pages menu, you will see general population counseling and testing submenu. If you expand this submenu, you will have a list of menus that links you to the functionalities under this permission. And the functionalities under these permissions are: create a client account for new clients. You request release of client's file for clients who have an account on the system. You collect client's information, is where you go to collect more information about the clients. You want to search client screening history. You want to update just personal information for subsequent visits. You want to look at all registered pregnancies. Now, starting from all registered pregnancies, my records, HIV screening at this site, these are all site level reports. The site you are logging in from is going to be the site that the system is going to pull records about. So if I'm from a particular testing site, when I click on HIV screenings on this site, I will only see records of the screening at my site. If I am not, if I was in a previous site and I want to see records about my previous site, then the supervisor will have to change the site you are assigned. So nobody can see records of another site. But you can retrieve records from any site if you have clients that move around. So maybe a client screened in the south of the island and the client is now in a health center in the north. You can get the unique ID, retrieve the record and update. As soon as you access the client record at your site, it is going to be listed under the sites that you have accessed. And if you do any screenings of HIV, TB, syphilis, or any other routine screening at that site, it will be listed under the screenings done at that site. So anytime you come to pages and you click on HIV screenings, you will get screenings only at the site you are assigned. And so you can export it if you need any site level reports that you want for internal, if it's an NGO or a private lab that wants to get their records, but it doesn't put the names of the clients, just a unique ID and some basic information about the clients, the type of testing done and what the results were, and the year of birth. So if you need to do any external reports, maybe an NGO, this will help you to get your basic data you entered into the system without having to go through surveillance. So we'll look at all of the site level reports first before we start entering records. The first one is all registered pregnancies. So if this is an ANC center, every pregnancy registered and every antenatal client that visits this health center will be populated on this page. So you will have their unique ID, the pregnancy ID, the dates they registered, and the name of your site here. The reason this name is here, it looks redundant because you already know the site you are in, is to remind people who maybe are frequently assigned from site to site that now they're viewing this record, but they've not changed their site of assignment. So if maybe there are people who are assigned to one health center and maybe have another visit in a different health center on a particular day. If they log in on that day, their site on the system was not changed. I want them to be able to remember that the records they're viewing are records of this site alone. So we want to get my records. The my record links takes you to the list of unique IDs of all the clients whose records you accessed and the address of your site at the time you access to the records. So in the event you forget a unique ID or the client forgets their unique ID and they come back and they can remember a sequence of numbers, but not everything. If you go under, and you are the nurse who saw the clients the last time, if you go under my records, you might be able to guess a unique ID, use it to try to retrieve the record and see if the name on that record or certain personal parameters matches the person in front before calling the supervisor to help retrieve if you are not able to retrieve a unique ID that is missing. Then if you go to HIV screenings at this site, it gives you a summary of the number of people screened for HIV at that testing site, the total number of males, females, and intersex from the total number, and then gives a table, an exportable table of the unique ID, ethnicity, the year of birth, the year of screening, the results, the testing modality used, and the type of test that was done for those clients. And the page is paginated in tens, and so you go 2, 3 to get all the lists. So you get 10 on a page, and you click on the pagination below to get the next 10 and the next 10 till you get to the end of the list of clients screened at your site. Then we also have syphilis screenings at this site. So this will give me all of the syphilis screenings that was recorded at my assigned site, the number of males, females, and intersex that came in for screening, and a table that I can export if I need to make any reports for my site. Then we have TB screenings at the site also. So if there is a tuberculosis screening done at my testing site, I'll be able to get the list of all of the screenings done. And then any other screenings that are done there that is not HIV, TB, syphilis will be displayed in other screenings. So these are the site level reports that the system generates, and it generates this based on the site assigned to the logged in user. So every user at the site will have access to the list of all of the screenings done at their site. Now we'll go back to creating client accounts. When a client walks in for the first time, regardless of the population the client belongs to, whether key population or general population or pregnant, anybody who walks into any health center or testing site or management facility for the first time, you come to the pages menu, go to the general population and counseling, general population counseling and testing submenu, and click on create new client account. If the client has been tested and have an account on this system previously from any site within the country, you should not create a new account. You come back here and instead you go to request release of client's file. So I'll repeat that again. Anytime you have a new client who has never been tested at any site in the country or doesn't have an account on the system at any site in the country, you create the client account. For today's demonstration, we are going to use case 5. And case 5 is a case about Josette. She is a 15-year-old Form 5 student. After not seeing her period for 2 months, she presents to the health center. A pregnancy test reveals that she is pregnant. Her last menstrual period was 13 weeks ago, and this is her first pregnancy with no history of chronic medical illnesses. She has a family history of diabetes and hypertension, and she has no surgical history or medications. So she presents with a mild, non-productive cough. Her HIV and syphilis screenings return non-reactive. So we'll stop here and do the first set of the story, and then we'll come back to the story to see what happens next. So we are creating our account today. And the story tells us that she's coming in because she's pregnant. So today is 7th of February, 2022. Contact of reporter here means the email address, the phone number, any contact that your supervisors can reach you on in the event they go through the records you fill in and they find an error and they want you to correct that error. So I'm going to put the contact. The facility type. So I'll assume that we are in a private lab. The first name. Her first name is Josette, right? We are going to make up a last name. So we'll give her a last name, Johnson. Her date of birth. The story says that she's 15 years old, which makes her
Mildred,
born. Yeah?
Mildred, you skipped the name of reporter.
The name of reporter? Yes, the system automatically puts the name of the logged in user. So it's not a field I can edit, it just tells me this is the account I'm using to fill in. So the name of reporter will always be equal to the name of the logged in user. And since I'm using an account that is a test account on the system, it gives the name that was set for that test account. So the site of reporter also is going to be there automatically based on the sites that the supervisor or that you were assigned when your account was created, or your current site when your account was updated. Is that clear now?
Yes, please.
Okay. So her date of birth is, so let's assume she was born on the 12th day of January, and she's 15 years old, so which means she was born in 2007. She's female, and her mother's maiden name, let's assume her mother's maiden name is Solomon. And the testing code will be generated automatically. Now again, testing codes are not used as a unique ID. If you choose to use the testing code as a unique ID, you must note that a testing code in a country, you can have up to 10 people having exactly the same testing code. And so the first client you use the testing code for has the unique ID will go through, but subsequent ones will be rejected because the system would have seen that this code has been used to uniquely identify somebody, and the system will no longer accept it as a unique ID for subsequent people. So to save yourself all of that stress, and it's also not security-wise because it's easy to guess a testing code once you know the algorithm. So you can use a unique ID. Unique ID should be decided within the country, and it should be whatever you want as a unique ID, either the ID card number of an ID card or the hospital registration number, any number at all, or you make up one. So we're going to make up one. JS 2022 F and photo. So write this down. And this type of ID, I will assume we are using her hospital registration number. And I'll create this account. So now she has an account. You want to tell her that the ID she gave you, or the ID you will write down on the paper, is a unique ID. If she goes to any site within the country for HIV testing, for syphilis testing, she goes to any infectious disease clinic, she should always remember the ID or take it along so that her account can be retrieved for updates. So she will never need to create a new account within that country going forward. Creating new accounts when she forgets her ID will just give you duplicate records in the system, and then your reporting will not be 100% because you have 3 accounts for 1 person. And so the system is going to uniquely identify everybody on the system based on unique IDs. And if 1 person has 3 unique IDs and 3 identities on the system, then it's going down 1 person will be counted as 3 people. So you want to try as much as possible not to create duplicate accounts. Once you do that, you go back to your pages menu on the left, expand your general population counseling and testing submenu, and go to the next menu, which is request release of client's file. You must do this on every new day when you need to access a file. The system withdraws all files for security purposes at 11:59 p.m. The system also logs the different access. So from any site, once this record is accessed, the system logs it and reports it to the supervisor. So if there's 1 person always snooping around in a particular file for no reason, no record of testing, no record of updates, the supervisor might want to find out at some point what that person is constantly retrieving the client's file for. So the supervisor sees this, and when we get to the workshop for supervisors next week or the week after, we are going to see how the supervisors see the log of different clients' access and what each person does on the file. So today is 7th of February, 2022, and the unique ID was JS2002. No, so it was JS2022 F0202. We want to screen her for HIV, for TB, and for other STIs. Now, once this is released, we can move back to the pages menu, go back to the general population counseling and testing submenu, and click on collect client information. So the menu is arranged in order: create account, request release of client's file, collect information. Now, the client's card has been released, and we are now on the card of the client. In the container above, the first thing you want to do is to verify that the unique ID displayed on this file here is the ID of the client that you are trying to view. If you are in the wrong file, you want to go back to collect information and enter the correct unique ID. If you are not sure if this is correct, on the personal information tab, if at the time of entry or the time of account creation, you enter the names of the clients, you will see the name on this form. Now, entering names depends on the regulation in your country. So if names are not allowed, you put the first letter of all of the names, or you put unknown, depending on what regulation is. The system allows you to enter names or not enter names. When the system wants you to enter names into the field, just type in unknown if you're not allowed to collect names of clients. In the container, we have 2 important summaries. We have the basic summary and the behavioral summary. Once you fill in the personal information of the client, the basic summary is going to be populated based on the information collected. So the only information we know about this client is that the client is 15 years old and the client is a female biologically. We don't know the sexual orientation yet. We don't know the gender identity. We don't know the number of sexual partners and if the sexual partners have been tested. We also don't know anything about the client's behaviors. So we are going to go further to collect information so that the system will populate all of these important summaries that will help us decide the risk reduction plan and how to go about risk reduction. And so we are not doing risk reduction today, but the purpose of this container is for risk reduction. This is the shortcut to start a risk reduction plan for users who have clients that come in, they have very risky behaviors, the test negative and you want to start a plan right away, you can click here. If you are giving out condom, you click on start risk reduction, enter the number of condoms you're giving out pamphlets, and the partners, you are giving advice of post-test counseling. This is where you enter all of that information. And if you want to look at the previous risk history and see if this is a client that has come several times for testing, and you want to see if the risk behaviors are getting worse, getting better, or sticking to the plan. And you can look at the various risk reduction plan that has been offered to the clients in the past using the third button. So we are going to go to personal information. You must always enter the date of the report. Now, fields that were entered into the system previously will be populated automatically, so you don't have to enter any information twice. Once you have it somewhere in the system, it comes on the form for you to reduce your work or not to allow duplicate entry of the same information. We have ID type 1, ID type 2, ID type 3. What this means is if there are different IDs, for instance, you use the hospital registration number for this client has the unique ID. Maybe you want to add other things, social security number, or you want to add the national identity number or something. Just for you to have a list of IDs, in the event the clients cannot retrieve their ID and they have any other ID that they have registered on the system, it will be easy to retrieve the ID and to switch ID for the client. But if there is no other ID to enter in, you can leave all of this blank. It is not a required field. The date of birth is automatically there because we put this in when we created the accounts. The country of birth is a required field, and so you ask if the client does not want to tell you, you can select unknown. So we'll assume this client is telling us the client was born in Antigua and the client lives in St. Lucia. The address in the country of residence. So the client lives in St. Lucia, and let's say the client lives in Castries. So the health districts or wellness center. So normally the admin configures the list of health districts so that you can select from the list in the drop-down menu. And so we don't have the health district that fits her location. We'll select anything and assume that we have that health district in St. Lucia. So we'll put this. The parish also, we're going to assume any parish. And then the length of time in the country of screening. Now, the length of time in country of screening is in years. You might have situations where somebody was born in a different country, is resident in a different country, but is coming in for screening in your country. So you find in this situation, maybe the person lives in St. Lucia, but we are screening from Dominica. The length of time in this country now is going to be 0 because the person doesn't live here, right? But the person is here and possibly wants to extend stay, and for immigration purpose needs to do some screenings. And so the length of time is 0. But in the event where the person is resident in the country of screening, then you want to ask, how long have you been here? If the person's country of birth and residence are the same, so the person has been here almost all their life, but you want to ask, and let's say she said for the whole 15 years of her life, she has been in St. Lucia. She was born in Antigua. She came into St. Lucia when she was 3 months old, and she has been here. So she has been here for 15 years. So her gender identity now is she was born a female. So we want to find out if she still identifies as a female, as a male, transgender, transsexual, or she unknown is she doesn't want to talk about it, or in the case of a child who is less than 5 or less than 10, you want to put not applicable. So let's say she said she identifies as female and her sexual orientation is heterosexual. Her telephone number, it is optional. If you are allowed to collect that, and if the client wants to give you, you can put it in. If not, leave it blank. Her marital status, she is single. Her ethnicity, let's say she's Black. Her occupation, she's a student, according to the story. Her highest level of education, she's in Form 5, which means the last completed level of education would have been primary. Her number of sexual partners, let's say she has 2. Later down in the story, we know she has 2 to 4 sexual partners. The type of sexual activity that she has gone through, she has had vaginal sex. We don't know about oral or anal. She's currently pregnant, and her regular sexual partner, she said she doesn't know if he has been tested. She's alive. Her cause of death is not applicable. And she has not left the country, although since she came to St. Lucia, she's never left. So we'll say no. We're done with personal information. As soon as it is submitted, the basic summary is going to be updated to fill in her sexual orientation, her gender identity, her number of sexual partners, and the test status of the sexual partner. And so at this point, if you want to start thinking about a risk reduction plan, want to ask her to bring her sexual partners in for more testing, or you want to give condoms or some self-test kits, this is the information that guides your decision. Then we go to risk behaviors. On this system, to make your reporting or your data useful, you want to collect personal information as much as it is allowed. You want to collect all of the risk behaviors. The comorbidities or others are optional, except the person becomes positive. So we'll do risk behaviors. So has she had sex with males? And the options are in the last 12 months, over 12 months ago, never, unknown, are non-applicable in the event we are talking about a toddler. So had sex with males, she said yes in the last 12 months. Had sex with females, she says never. Had sex with persons of known positive HIV status, she says never. Had sex with sex workers, she says never. Has she exchanged sex for drugs or material gain, she says in the last 12 months. Has she shared needles while injecting non-prescription drugs, she said never. Crack cocaine or illicit drug use, she says never. Has she had sex under the influence of drugs or alcohol, she says never. Has she had sex with multiple partners, she said in the last 12 months. Did she have perinatal exposure to HIV? I said no. Received transfusion of blood or blood products or clotting factor, she says never. She is still a student, so this is not applicable. Is she a victim of, has she ever been a victim of sexual assault? Let's say she says never. Has she received a transplant of tissue or organ or artificial insemination? We say never. So do we have a confirmed diagnosis of any other STI at the time of this HIV testing? We'll say no. Confirmed diagnosis of TB at the time of testing? No. Has she had contact with confirmed TB? She says no. Has she been previously diagnosed with HIV? This question is for TB patients, so we'll say it's not applicable. Does she use a condom? She will say rarely. Has she ever been incarcerated or have history of incarceration? We'll say never. And has she ever been homeless? Let's say she said in the last 12 months. Is she a sex worker? She says no. And has she had sex with a transgender female with prior knowledge? And she says never. And now we've collected all of the risk information. Once this is done, the system populates the important behavioral summary that will guide further risk reduction decisions. So everything that she has done in the last 12 months and everything that is time sensitive. So if the last time she did that affects her risks, the extent to which she is at risk, it is going to be in red. Everything she has done over 12 months ago that is time sensitive is going to be in black text. So we've collected what data we must collect for every client. It's time to go on to screening. The comorbidities, you can also collect that to see if she's diabetic, she has lymphoma, renal disease, chronic lung disease, high blood pressure, or any other pre-existing conditions that she has. You want to check if there's alcoholism, malnutrition, and also select the reason for test. And this reason is ANC. And then you want to see if the client has been previously tested, the date and the location. If the client has been previously diagnosed with HIV, the date and the location. If the client has been previously diagnosed with any other STI that is not HIV, the date and the location, and also if the client has been previously diagnosed with TB. So before I move on to screenings, can we have questions if we have any?
No question from my side.
Okay. So now recall that we are giving a story of a pregnant lady. And the screenings we are going to do is because of ANC. Once it is an antenatal clinic and the person is coming in for antenatal, fill in personal information, risk behaviors, optionally fill in comorbidities, and just go straight onto vaccination history. If the client is not a pregnant client, and this is not an ANC clinic, you are going to do personal information, risk behaviors. This is optional. The comorbid information is optional. You fill in the HIV screenings, if HIV screening is the screening you're doing that day. Also TB screenings, if you're doing a mantle test, or if this is a lab with doing other TB tests, you can fill them in from the list of tests. And the syphilis screening and any other screening. Then if the person is positive or the person is at high risk, you want to do, or you are doing a partner notification service, you want to do contact listing. If the client wants you to call their partners for the same risk reduction plan or for testing, you list the contact here so that whoever is in charge of contacting contacts or for partner notification will get the information to do the contact. Then you fill in extra notes if you need to leave any note in case the client goes to another site or the next time the client comes, another user is seeing the client. You can also upload results. If you have any reports or images you want to upload, you use that. But because we are dealing with antenatal, we are not going to use any of these tabs. So let's see the difference between an antenatal client and just a regular client. For a regular client, you don't bother about new pregnancy registration and antenatal and maternity follow-up. You fill in all of the tabs above up until vaccination history. For antenatal clients, you fill in personal information, risk behaviors, and go straight to register the pregnancy. Again, if your client is biologically a male, the forms will stop at vaccination history. Only for people who were female at birth and whose sex at birth was registered as female on the system will have pregnancy history, pregnancy registration, and antenatal and routine follow-up files on their list of files. So when you register a male client, you will not find any of these pregnancy-related forms on the page of the client. Vaccination history is necessary so that you want to see all of the vaccines that the mother have had. So if the client comes in with their vaccination card and you are giving, you want to record all of the vaccines the clients have had here, but you do not put in the new vaccine that you are giving under the pregnancy. You want everything about that pregnancy to be in the pregnancy file. So register the pregnancy. If we look at pregnancy history, the client has never had a pregnancy registered on the system, and so it is blank. We registered this pregnancy she's here with. Now, the address of registration site is here automatically. The person who is logged in is going to be the person registering. The client's name is populated automatically based on the name that the system has when the account was created. The unique ID is there, and the current age is there. Now we want to put a pregnancy ID. And so you want to come up with your convention of generating pregnancy ID within your country. But this is what I will use. I will take the unique ID. I will see what number of pregnancy is this. She says 1, I'll put pregnancy 1. And this will be easy for me to remember the pregnancy ID. So the next time she comes, I only want her unique ID. And if you say this is her first pregnancy, I'll know that I'll just put a suffix of preg1 after her unique ID. So it is up to you in the country to decide what convention will be easy to remember and will not need anybody to store so much information of different IDs. The date of last normal menstrual period. The scenario said that 13 weeks, our last menstrual period was 13 weeks ago. So if we calculate 13 weeks from today, I'm back from today. So to fall like somewhere around the first week in November. Yes. So let's put her, I hope this is correct. So 13 weeks ago, so let me leave her 7th of November. And the story tells us of who the pregnancy father is. So when we go further to read the story, she breaks up with her partner and baby father, Philip. His name is Philip. So we're going to put his name there. The story does not give us a last name. So we don't know the last name, or we can make up one for the purpose of this demonstration. But in reality, we are not making up anything. We put in information we know. His occupation, let's say she said he is also a student, and she doesn't want to give us his contact, but she gave us her mother's contact, or her mom is there with her contact as the emergency contact. And then this pregnancy is registered. Once you register a pregnancy, the next tab is going to be populated with all files and all forms for this pregnancy up until the birth registration and discharge of the baby when the baby is born. So every time the client comes in for a routine antenatal visit, this is the tab you go to, the last tab, antenatal or maternity routine follow-up. This particular form has flags that gives you when HIV screening is done, the gestation age when the screening was done, the gestation age when the last syphilis screening was recorded, the current gestation age, and then it gives you several other forms on the right side of the form below the main flags. Above this, you have the pregnancy ID. So you want to be sure this is the current pregnancy. The system automatically gives you the file of the last recorded pregnancy. So previous pregnancies will not be displayed, but will be summarized as obstetric history. And then you can go back to the file to retrieve past pregnancy if you want to go into every detail of the pregnancy. But the key information from the last pregnancy is always populated in the new pregnancy once you register a new pregnancy. So we have the pregnancy ID here, and this is the pregnancy we want to record information on. Because her maternal age is less than 17, the system puts a flag here telling us about her maternal age. And if this is a risk in your country, you might want to see if she goes to a high-risk clinic or if there's any other way you handle adolescents that are pregnant within the country. But the flags are there to remind us of key information that we might want to take decisions on. On her pregnancy file, we have enrollment information. So any of these you click on will display a form below. For the pregnancy enrollment, you want to collect all of the baseline information. You put in the date. All of the information that has been collected about Josette previously will be on the form already. You can edit them if anything has changed, but you can leave them there if they are still the same. So the baseline information, one of the information we want to get is the first weight we have registered as our first visit. So let's say today she weighs 175 pounds. And so the system will automatically convert it to kilograms. Her height is 175 cm. The system converts it to meters, and then the BMI will be calculated automatically. Date of last delivery. This is her first pregnancy, so we can keep that blank. Type of last delivery, number of children below age 18. So she doesn't have all of this information because this is her first pregnancy. The date of last normal menstrual period was filled in when we registered the pregnancy. If that has changed, or at the time of registration, she said the date she gave us wasn't correct, you can update it here. If she does a scan and we find out that things are way off and you want to update the date, you can update that here. And then you can leave the expected date of delivery and the system will regenerate it. And when you submit the form, or if you feel like putting in whatever the scan tells you, you can put it in here. But the system automatically puts what the system generates based on the information that the system has. So the relevant family history, they have a family history of high blood pressure, no tuberculosis, of diabetes, and there are no history of twins. We asked her if she has allergies. She says she doesn't know of any allergy. And she has never practiced family planning. So because she has never had any child in the past, there's no previous obstetric history, and we have nothing to fill in here, and so we're going to leave it blank. So what the system does is that if she had pregnancies registered in the past, we'll have a table above that will give us the previous history, and we'll have this form that will allow us to fill in new history that the system doesn't have as a record, or maybe she came in with records of what she has had in the past, but wasn't registered on the system. So you can put in the basic information of her past pregnancies. So you want to put the year she had the baby, any events of if the baby is the outcome of the pregnancy, if it was an ectopic, live birth, missed abortion or miscarriage or stillbirth or neonatal death. And then if what the sex of the baby was, the weight, the status, if the baby is still dead or alive or is alive with a birth defect, how long they stayed in the hospital, and the type of feeding of that baby. So because she doesn't have any, we are not filling anything here. If she has had more than one baby in the past, you keep adding rows to have as much rows for as many babies as she has had. But in the event you don't have anything, you just click on update and we are done. So it saves this and it tells us that the system has no previous obstetric history recorded. So this is saved. Once you are done, you come back to that tab, you go back to the enrollment information, you check to see that everything you recorded is retained on the form for easier updates in the future. So whenever anything changes, if she discovered that she took a medication today and she reacted, you can come here to update her allergies. You can change any information that she changes along the line during the pregnancy. The next thing is risk assessment. Now, this risk assessment is the pregnancy risk assessment and not the behavioral risk assessment. Both risk assessments are important on this system. So even if you take the pregnancy risk assessment, you want to always record a behavioral risk assessment for any client that walks into your site. So for the pregnancy risk assessment, we want to select the date we are recording this. And then we want to look at her behavioral risk. Does she use tobacco? Let's say she doesn't use tobacco according to the story. She doesn't use substance. But in the event she does, we'll do that. If it's less than 2 years since her last pregnancy, you're going to check that up. She's an adolescent. She has less than high school education. She's currently in high school but not graduated. And then medical risk, she has no medical condition, and so there's no medical risk. Obstetric risk, for now there is none we know of. She has everything in order. She has no pre-existing health conditions. She is not anemic yet, and she has no previous pregnancy issues. So we're going to update this. And the system should add flags based on what we have selected. So if we check information under the risk assessment that is to be flagged, it is going to be added here. But because she has no risk flags to be generated based on her pregnancy risk assessment, the only thing she has here is the psychological risks of adolescents and less than high school education. And adolescent is already flagged as a maternal age. And so less than high school education might not be a risk, except when it comes to the medications, and they want to make sure she has a better understanding, or she has a good understanding of what she needs to do. And that we'll see when we do the psychosocial and adherence counseling. The next thing you want to do is to record all the screenings done during this pregnancy under pregnancy HIV screenings. If you record them here, it is not going to be marked on this pregnancy. This is for general HIV screenings anytime. You can record it here and you can still come back here, but you need to record HIV screenings done in this pregnancy in the pregnancy file. So she is having her HIV screening today on our first visit. And the type of test will be HIV rapid test. We want to choose a non-reactive result for today based on the story. The test kit she used was determined. So the gestation age at the time of this screening is here. In the event she has screened somewhere else and she comes to the results and she screened during this pregnancy and she doesn't want to be screened again now, maybe she screened 2 weeks ago, and you see the dates when she was screened, you can update the gestation age to that date when she was screened. So let's say she was screened at 11 weeks. So you can just put it at 11 weeks, or you can leave it at what the system generates. So if you are screening today, you are putting in the number of days. So she was screened today, 13 weeks and 1 day. So we can save this. Once you save this, you have the flag above updated to tell you when her last HIV screening was recorded and the gestation age when that screening was done. So this also helps the reporting to know those who are screened in the first trimester, second, third, and how early you screen clients when they come in for antenatal visits. And then it also informs you to know that based on her risk behavior or based on whatever standard is set, you might want to screen closer to delivery again. So we have the record here. It's non-reactive. We don't need to do anything further. We move to syphilis screening. So on this first visit also, according to the story, her syphilis screening is also non-reactive. So we're going to make it non-reactive. So we've saved this. So HIV is non-reactive, syphilis is non-reactive. There are other routine screenings that are done in pregnancy. And this is where you come to do that. If you are doing the TB screening, you click on pregnancy TB screening. If you are doing the hepatitis screening, pregnancy hepatitis screening, you fill in the form, the date, the type of test, the gestational age at the time of screening, the results, and the date. So you have HIV, syphilis, TB, and hepatitis on separate forms, and you have every other screening on the pregnancy routine and other screenings form. So here you just have a drop-down menu that tells you, gives you a list of all the tests based on what the administrator configures. So you can get the list from the lab and put an exhaustive list of all the tests that is done within country or sent out as overseas tests, so that when you come to your drop-down menu, and you are selecting a type of test. So let's say she's doing she doesn't know her genotype. So let's do HIV electrophoresis. And we are waiting results, or we'll say we've gotten the result. And she's, yes. So at this point, we might want to do a sickling test for the baby's father. So the result is not applicable here, and the date is 7th of February 2022. So all other pregnancy routine screenings will be recorded on the pregnancy routine and other screenings. And you also always get the list of the screening histories that have been done and what the results are on the left of the same page. If you are given any immunizations during this pregnancy, you are going to enter the date of the vaccine, the type of vaccine you are giving. Let's say you want to give the pregnant mother a Hep B vaccine. You're going to enter the date, the type, the series, if this is first dose, second dose, booster dose, whatever dose it is. If it's a one series or annual vaccine, you just enter it there. And then you are going to put the time of the vaccine, the time the vaccine is given, and the date, the manufacturer, the batch number, the place of the vaccination, the current site or the current site of the logged in user is going to be put in as a place. If the person got the vaccine from a different place and you have the card that the vaccine was taken during this pregnancy, you can put it in here and the name of the person who gave the vaccine, and you save it. And then you have the vaccination history during that pregnancy. If this person was reactive to one or more screenings or is an injection drug user, he wants to screen sexual partners or injection drug partners, or in the event of a mother who has other children before this pregnancy and she tests positive, the other children. You will use these partner screenings or partner notification service tab to create the account of any partner of this client. So all her sexual partners and injection drug partners and children screening can be done through this tab. So you want to link every partner to the pregnancy, so that in the event one sexual or injection drug partner becomes positive, you want to know that that positive partner is a partner of a pregnant client, and you might want to rescreen or know that the baby is also at risk, and any intervention that is in place will be done. And so that is the reason why you start the account from here. It's as good as creating a new account for a client. If the partner already has an account on the system, this form is not going to create the account, but you need to fill the form. All it's going to do is to just stamp this partner with this unique ID of the pregnant client, and will tell you the gestation age at the time this partner came in for testing under this pregnancy. Once you are done with all these screenings, the first visit, which can be exhaustive, subsequent visits, all you need to do is to come to this form. You will update anything that has changed in anything you have filled. If you are doing a new HIV screening, maybe this is a third trimester, she is over 30 weeks pregnant, and you want to repeat her HIV screening.
Hi, Mildred.
Yeah?
Could you just go over that for me, please, the partner screening, before you move on? Thank you.
Okay. So under partner notification services, when anybody is reactive to or positive, confirmed positive to one or more tests, or the person has a very high risk behavior and is going through a risk reduction plan, and you want the partners to be part of the risk reduction plan. If the client is pregnant, come to the pregnancy file and go to partner screenings. Partner here refers to both sexual partners, refers to injection drug partners, refers to children and siblings. If the partner already has an account on the system, collect the unique ID, and when filling this form, put in that unique ID as the unique ID here. And so the system will not recreate the accounts, but it will just associate the unique ID to the pregnancy. If the person has no account on the system, you fill in the form and the system is going to see that this unique ID does not exist, and it will create the account and redirect you to the retrieve the client's file and collect information to get into the file now of the partner whose account you just created under the partner screening. Is that clear now?
Yes, please. I just asked because I was looking at this yesterday and I had problem with the first part, the reporter's information, the very first part of this. I wasn't getting anywhere, so.
Okay. Okay, so here the reporter's information, you put in the date, which is today's date. Let's fill it out. The contact of reporter will be your contact. Let's say I want to put in an email address. And I will put in the facility type. I'm in a private health clinic. The pregnancy ID is already there. The gestation age at this screening is here already. So the first name of this partner that I'm screening is Philip. His last name is unknown. And his date of birth. So I want to assume that Philip was, and let's say he's 19 years old, and he was born in 2005. His biological sex is male. His mother's maiden name is unknown also. His testing code is generated automatically, and we'll have a unique ID for him. Let's say it's PPJS22, and I'll assume this is his social security number, and I will create. So once I click on OK, it will redirect me out of the pregnancy file to retrieve his own file so that we can start collecting his information. So once we are done with the pregnancy, we'll come to his file and we're going to collect his information. So we'll go back to the pregnancy. So you will see that if I come back to partner screenings, I'll see that the unique ID of the client that was screened under this pregnancy is there, and the gestation age at screening. So whoever is doing the contact prevention or the risk reduction, if Josette's risk becomes so high, and you want to make sure that all our sexual partners are also as protected as she is or has access care, you might want to look through the file of these partners that are screened under her to see what care or what kind of prevention intervention they are on, and what their test result is. If at any time any of our partners become positive, at her next antenatal visit, you need to do what you need to do to make sure she has early intervention in the event that she also gets positive. So her new antenatal visit, so she's coming in for a visit. So every time she comes in, so let's say she's high risk, you give her every 2 weeks appointment, she has to come. Every 2 weeks she comes, all you need to do is to go to new antenatal visit. All of these things we have done here previously, you don't need to do them again. They are one-time data entry, except you need to update something. And when you need to do an update, you don't need to fill out the whole form. You only need to put in the dates and then go to the part that needs to be updated. Maybe her emergency contacts changed, you just change that one and save it. Every other thing on the form remains the same. So just the date and the particular field you need to change. But what you fill out at every visit is the new antenatal visit. So at this visit, let's put in an information. Her gestation age is 13 weeks and 1 day. Let's say we don't have a fundus height yet, we'll leave it blank. Presentation and position, almost everything apart from the fetal heartbeat is not, we don't need to feel at this gestation age. But the fetal heart, let's say she's having a heartbeat of 85 beats per minute. So she's at the risk of miscarriage, right? And the date of first movement is not there yet, or she doesn't know yet. Every other thing is okay. Her ALB, let's make it high, 4.7, and her sugar, let's make it above. So if we are doing hemoglobin A1C, let's put her above 8%, so that it can be high. And we are going to stop here. But there are other fields to collect for when the pregnancy advances, or if she's a high risk pregnancy and we are getting an OB consult, then there are a lot of other fields that the OB assessment requires to be filled in at some point in her pregnancy. But you fill in only information you have that relates to her gestation age or that you do at your health center. And then you fill in if you have special observations or other notes, you fill them in here. She's looking pale. She looks like she was going through abuse, or she looks like she has bruises over her body. Any observations you have goes here. If you have any other notes here, if you have a doctor's visit that day and the OB is there, she can or he can fill in the information here if it is available. And then you save what you have. So for this antenatal visit, those are the information we collected. And anytime you go back to her file, you can go to previous visit and you will always find all of the previous visits in different containers. So if you have field 5, you find 5 of these containers that gives you all of the information that was filled in at her last visit. If you fill in a new visit information here, you have 2 of these containers, but with the most recent first. Any question?
No.
Okay. So if you need to upload a file, you use upload file and you select the file you wish to upload and then you upload the file. If the baby is born, you come here to put in the dates the baby is born. So we're going to assume this is not possible, but we're going to do that. Let's assume she's 39, 40 weeks today and she's having the baby. So if the baby is born, you put it here. This baby was born at 6:55 a.m. Let's say she had multiple gestation. She has 2 babies, twins or triplets. One came at 6:55, the other came at 7 a.m. They just follow themselves. And then the place of birth is, she's in St. Lucia, right? And then the notes. So anything that happened during the labor that you need to put in there will go there. If you don't have that note now, you just want to put in the place and the time of delivery, you put that in. Mother's condition on discharge will be the day that the mother is going to be discharged. But for now, all you are doing is just updating this with the information you have. When you come back the next day to update that information of the birth, you can come back here and fill in the information that you have not filled in previously, or the mother is being discharged. You can fill in the mother's discharge information. Once you have filled in this basic information of the date of birth and the time of birth and the place and any events that happen during birth, you can go to register babies now to register the babies. So you put in on this register baby file, just so that somebody does not forget anything. It gives you the mother's HIV status and the syphilis status of the mother. So at this point, whoever is registering this baby will remember to send the mother or anybody to exposed infant registration, so that if the mother was positive, it is on this, you want to make sure that the child is registered as an exposed infant in the clinic for exposed infants. So once you are registering this baby and you put in the baby code, you want to send the code to whoever is in charge of exposed infant so that the child will be registered once they come in as exposed infants. For baby code, it depends on what you use in your country. But to make it easier to remember, I want to take the pregnancy ID. And I'm going to use this and put baby 1. In the event that is multiple gestation, right? And I'm having more than one child. So I'll put the next one as baby 2. So it's an easier baby code to remember. The pregnancy ID, baby 1, the pregnancy ID, baby 2, or the pregnancy ID suffix with the name of the baby if the baby already has a name. So I'll make it 1 baby for now. You fill in the sex of the baby. So this was a male. They've given the baby a first name to be Johnson, the middle name to be Solomon, the last name to be Kingsley, and then the birth weight. This baby was born 7.1 pounds. The length at birth. So we discussed this on last week that we're going to add all of these parameters. So I added them already. So the length at birth, we'll say he has a normal length, falls within the normal length range, 46 cm. The head circumference, let's make it in the normal range, 34 cm. And we'll put the chest circumference to be 31 cm. Then the ABGA score now at 1 minute. So I want to assume that the first 1 minute, the baby had a pink body and blue extremities, so the score will be 1. So I don't know, how do you do the score? Is it from 0 points to 2 points, or you type in a text? And
our ABGA score is up to 10. In that for each category, you give 2 points. You look at 5. So each categories you give 2. So if you're looking at the skin color and the baby is not really blue, neither is it pink, you give them a 1.
1, okay.
Yes, so our thing is up to 10.
Okay. So for each of the categories, so appearance will be 0 to 2. So 0 if they are blue and pale, 1 if they have like between pink and blue, and then if they are all pink, then 2, right?
Yes.
Okay. So I want to say this baby has pink body, blue extremities, so 1 point. The pulse is below 100 beats per minute, so give 1 point. The reflex or irritability is, there's maybe a minimal response to stimulus, and put 1 point. And then the respiration or the activity, sorry, let's say they have flexed arms and legs, 1 point. And the respiration is slow and irregular, 1 point. At 5 minutes, everything became normal. Was pink at 5 minutes. The pulse was over 100 beats per minute. The reflex and irritability became prompt response to stimulus. So put 2. The activity, it became active. And then respiration became, it was now a vigorous, loud cry. So 2. Am I correct?
You are.
Okay, so we'll save this. So this is how you register the baby. And anytime you need to update whatever you have registered for a baby, you can come to update baby and you'll find the information for you to change whatever is there. At this point is the update baby that you will use to put in the discharge weight. If the baby is going to be there for 48 hours, what is the weight later on? And any other thing you need to put in here. And then if there are discharge notes, you put in the notes, you click here to update that. And that is the end of this pregnancy. If the client needs to go to the ID clinic or for care and management for exposed infants, then you want to give the baby code so that they use that baby code at the ID clinic to register the child as an exposed infant. But your work at the health center or at the ANC clinic or the maternity ward is done with this baby. Any questions?
I was just wondering, Mildred, if Okay, like as in the case of I working at the ID clinic,
Yeah.
and more than likely I will have to do these fill in these information. I can't remember seeing any part on this part of the this screen that marks referral, because I'll have to refer her to the doctor for treatment. Oh, that
Yes.
part comes in.
No, you don't refer exposed infants, you just register them. But
No,
for
I'm not. No, not the infants. The
the mother.
mother.
Okay,
Yeah.
for the mother, let's put in one of her HIV screening. This is 7th of February 2022. Let's assume that this is now positive. What the system does, if HIV is positive or syphilis is reactive, it automatically sends a referral to PMTCT. And I'm going to show you that now. So this is 7th of February 2022. So we click on save. So now she is positive, and so it will tell us that risk information has been registered. We'll click OK. When we go back to the page, we should see that we should have that client is HIV reactive or positive here. When we go to PMTCT now, which is under prevention control, the PMT coordinator should see on their page, when they click on pregnant client registration, they should see new positive pregnant clients are available for registration, get list, and that person now should be on the list of people who the system referred automatically has been reactive to either HIV or syphilis. The system doesn't care what, but once they're reactive to one of those HIV, syphilis, TB, it just sends a referral to PMTCT to follow up. The PMTCT coordinator now will see this on their page and will want to find out when this person is coming in. Click on form, the form displays for them to start filling information on what the syphilis test result is. So this referral came in because the person was HIV positive. The PMTCT coordinator can see that the system said that syphilis test was done and it was non-reactive. They want to find out if treatment has commenced, yes or no, the number of children under 15 years, and fill in all of this information once the person comes into PMTCT clinic. For the mother, outside of PMTCT, you have to always go to referral when somebody is positive, regardless of whether they're pregnant or belong to any population. If the person is HIV positive, just refer new HIV case for care registration and management. If the person is has a positive TB result but does not have HIV, refer for TB case treatments and refer the TB case for treatments and management, even if it's a presumptive diagnosis of TB. If the person does not have HIV or TB but has other STIs, do the referral for other STIs. If the person has HIV, has TB, has other STIs, just refer for HIV, and every other file is going to be added as opportunistic problems for the clients. So you just refer for HIV. So now we want to put a referral for when she's done with her pregnancy. You want her to be in care. So you always refer for care and management. PMTCT referral goes automatically because the system wants to have different layers of people who check. So if one person misses it, the PMTCT coordinator is always there to want to find out why they still have list of people on their list that are reactive or positive, but they are not yet in care. So I think on the system, the job of the PMTCT coordinator will be to register when they started PMTCT and follow up to make sure that they have started any intervention for both HIV and syphilis while they are pregnant. So we'll put in her unique ID here to refer her, and her unique ID was JS2022 F0202, and her category now is pregnant, and then we'll refer her for care and management. So it is now that when we do, I think it's tomorrow's training workshop, we will see what happens after the referral. But for the level of the health centers or the ANC clinic, this is where they stop. After referral, they are done. But now when you now at the ID clinic come, you will go to care registrations and initial evaluation. When you click on that, we're going to look at that tomorrow. You are going to see all of the referrals that were done throughout from all the health centers or anywhere from within the country here. And whoever is in front of you, if you have their names on the system, is going to be populated here. And the person who referred them. So if you don't find this person coming into the clinic, you can now follow up with the person that referred them to follow up with the client so that they can come for registration. You'll get all your antenatal referrals here. So you will see those that are referred. Regardless of the population, it's the same registration you will do for pediatric, antenatal, or the general population. Only exposed infants have a different registration process. For exposed infants, when you come there, you will see register exposed infants here. And that is where you will get, register the exposed infant first. So you see a form, registration for exposed infants. And that is where you put in the baby code and the infant's name, or if the name is already there, you can skip that. But when you put in the code, baby's code has the infant's unique ID, then it works. If they don't have the baby code, you can ignore the baby code and just put in whatever information you are registering that day. But it's better to have the baby code so that at every point you will know that the product of this pregnancy, that the mother was HIV positive, is registered as an exposed infant. So I do not want to put that restriction in the events where the baby code changes or it is forgotten and then you are stuck with registration because you have to retrieve. So I just let this form blank so you can put in the infant ID and put in the names. And we just want to make sure as discipline that we are using the baby code as the infant's ID, but the system allows otherwise. Does that answer your question?
Yes, please.
Yeah. So any other question before we take a break, come back, and then look again at the process of screening her partner, and then we'll do some hands-on. Anybody with a question?
No question for now.
Okay. All right, so we are going to take a 10-minute break. The time now is 10:26. We'll come back at 10:36. Okay, we are back. Everybody back?
I am.
Okay. So is there any question before we move to breakout rooms? I want us to get some good 1 hour of hands-on, and I'll jump into every breakout room to answer questions. I'll keep rotating. So anybody with any question before we get there? So in the breakout room, what is expected is that we all try one case today. We want to look at case 5. And we want to have one person share their screen, another person present, everybody discuss on what should go where and figure out how to enter the information in the story into the system. So instead of restricting to case 5, maybe we can just try doing anything 5, 6, or 7. So you choose what case you want to use. There are some cases that has advanced information beyond the birth, even clinical management. Ignore everything that has to do with clinical management and just focus on what you do at your site and follow the case to see how you enter the information, just hands-on. And then while you do that, you'll find out what questions you need to answer. And then when we come back, we are going to answer that. So I'm going to send everyone to a breakout room, and we are going to try hands-on. So we'll have 6 to 7 people in the room, and we'll start. So see you all when I get into your room. Hey, welcome back. So anybody have questions from the sessions, feedback?
Question.
Okay.
Based on the vaccination history that we were populating, is it the past vaccination that the client has received or what she's being currently given?
Okay, so the vaccination history, you put in all of the past vaccination, and then you put in the current vaccination.
Because some of the information for past vaccination you may not have.
Yes.
The
so
most you would have is just the date when it was done and what was given and who did it.
Yeah.
Some of them is
things
usually
like the
given on
manufacturer,
the client's
things like the
vaccination card.
manufacturer, etc.
Yes, but that is when the client has a vaccination card, you'll find most of those information on the card. But
Yes.
where you can find that information, you will you will skip it and enter as much as you have.
Okay, thanks.
Any more questions? So tomorrow we have the care registration, initial evaluation, and with the adherence readiness assessment. So we'll have the clinical care team and counselors for tomorrow's session. So before we go, can we have a round of introduction for attendance? So my name is Mildred Fakoya. For those joining for the first time, I am the developer of the case-based system. I develop systems for health and for education. I am a software engineer by profession, data scientist by profession, and I am a full stack developer.
Hello, everyone. I am Alexandrina Wong from Antigua. I'm an NGO manager. I'm a counselor tester.
Hi, everyone. I'm Monica Lavinier, registered nurse from Dominica.
Hello, good morning. My name is Atoya Massington. I am a registered nurse, a certified midwife, and acting public health nurse for the Grace Farm Health Center here in Antigua. Today is my first day on the session.
Good morning, everyone. I'm Juliana Daru. I joined late today. A registered nurse midwife and acting ward sister on the maternity unit, Dominica.
I am Gil Frederick, Registered Nurse Midwife, Maternity Unit, Dominica.
Good morning. My name is Juliet Blaise, family nurse practitioner, VCT provider, Grand Bay Health District, Dominica.
Good morning, everyone. I am Glover Williams, and I am a registered nurse attached to the Infectious Disease Clinic.
Good morning. I am Colin Harris, a registered nurse midwife, Dominica.
Good morning. My name is Nora Francis from Dominica, community health worker, testing and counseling, attached at the Grand Bay Health District.
Good morning.
Good morning.
Good morning, everyone. My name is Andrea John. I am a registered nurse midwife attached to the Dubla district in Dominica. I'm a VTC provider.
Good morning. My name is Mary Keynes. I'm from the island of St. Kitts, and I am a registered nurse, HIV tester, and counselor.
Morning. I am Andrea Williams from St. Kitts, HIV rapid test trainer.
Good day all. My name is Joycelyn Blanchard from the beautiful island of St. Kitts, VCT provider and providing care and support of persons living with HIV and AIDS.
Ephelja James, registered nurse midwife, Dominica.
Morning, everyone. My name is Chanel Ned. I'm a psychiatric social worker attached to the Ministry of Health here in St. Vincent and the Grenadines.
Good morning, everyone. I'm Dr. Stephen Adifa Gemini, a guest on the training.
Did we start back all over again?
No, we're having introductions for attendance.
Oh, okay. Lorna Wilson, nurse midwife, PMTCT coordinator, St. Lucia.
Good morning, Derek Ferdinand from the Ministry of Health, Health Security Department. St. Vincent and the Grenadines.
Good afternoon, Shafana Williams, IT Unit, Ministry of Health, St. Vincent and the Grenadines.
Good afternoon, everyone. Talicia Baino, counselor at the Hiv Clinic attached to the hospital, St. Vincent and the Grenadines.
Good afternoon.
Good afternoon. Yeah.
Good afternoon. This is Alicia Gregor from Dominica, Community Health Aide at Castlebrooks Health District.
Good afternoon, Karen Brotherson, Antigua and Barbuda, PMTCT coordinator, VCT provider for the TRH network.
Good afternoon, Henry Frias with 3H IT Department, Antigua and Barbuda.
Good morning, Mr. Lester Guy, Dominica, NAP manager.
You have that too loud, Leah. Yeah.
So it looks like we've had all the introductions. So thank you all. This is the end of today's session. If we have no questions, we can call it a day.
Eldrad?
Yeah?
Yeah, I'm not saying Veron, maybe she got dropped out, but she's a social worker at 3H. Veron Peters.
No, she was not. She was logged in at some points this morning.
Yeah, so I guess she told me she got dropped out.
Okay.
Maybe she can't get back in.
Okay. So I will put in the recording by the end of today or tomorrow morning.
Okay, thank you.
All right.
Oh, and Julian Kentish too. He's one of our providers.
Okay.
He was on, maybe he got dropped off too because he was asking me about the rooms. Oh, I think I just saw him.
Okay.
Maybe he has a problem with his mic. Julian Kentish and Antigua Barbuda. He's from the 3H network also.
All right. Just put that down. All right. Okay then. So tomorrow, clinical care team and adherence counselors or social worker. So we'll see tomorrow at 9 for those who will be in tomorrow's session. And have a very good afternoon.
Thank you and goodbye, everyone.
Thank you.
To you too. Bye.
Thank you.
Bye, everybody.
Okay,
Thank you.
bye.
Thank
Right.
you.
Bye.
Same to you all.
Bye. Have a nice afternoon.